Evening, Consul General Houston, Honorable Mr. Asim Mahajanji, thank you for joining us tonight. Consul General Chicago, Honorable Mr. Amit Kumarji, thank you for joining us tonight. Consul General New York, Honorable Randir Jaiswalji, good evening, welcome. Consul General Atlanta, Honorable Dr. Swati Kulkarni, welcome for this evening. And welcome to Deputy Consul General, San Francisco, Honorable Mr. Rajesh Naikji. And welcome to all our esteemed API members and friends. We are here today for a reason. As you all know, physicians of Indian origin in United States, we are almost 9 to 10% of the entire physician workforce. And we came to this country many years ago. We're almost 40 years old organization now. We came from every village, town, city from India represents here. And we serve in every rural region of United States. Almost 1 in 7 patients in United States are taken care by a physician of Indian origin. That's a very proud thing for us. And as physicians, we all are aware access to the health care is very critical for good health. But rural residents have a very limited ability to access this kind of preventive health care, what we see in United States versus in India. Especially the preventive care is really not on par. So in order to bring an awareness and importance of disease prevention, API this year has taken this initiative, Adopt a Village, for rural India, healthcare for rural India, a free comprehensive healthcare screening in 75 villages. Why we picked 75 villages? This is Azadi Ka Amrit Mahotsav, 75 years of India's independence. So we started this pilot project and we are very humbled that 75 noble souls have come forward to support this initiative, and very, very thankful to all of you. And this is our small contributions to our mother country, India, in celebration of this 75 years. And API also has extended not only this charitable initiative, but we are also working on a global initiative on education, medical education. One of them is the family medicine specialty, which is not well in all the programs in India, medical schools. So API is working with the National Medical Council to have a specialty, postgraduate specialty in every medical college in family medicine. So family medicine is a specialty where they can focus more on rural India. So hopefully we will be successful in helping our home country. And without much delay, I want to invite Dr. Satish Katula. He's the chair of the Adopt the Village program, and he's our secretary of API. Satish, go ahead.
Thank you so much, Anupama. Good evening, everybody. It's an honor and privilege to have all of you with us, especially all the consul generals of Atlanta, Houston, New York, Chicago, and Deputy Consul General of San Francisco. So it's really a privilege to have you all here, and thank you so much for accepting our invitation and spending your precious time with us tonight. I would like to talk a few words about Adopt a Village Committee, what it has done over the last few years. Vijaya, could you please share the slides? So we are going to launch this program, as you know, the Adopt a Village Rural Health Initiative in India. And I want to talk about what we have done in the past in the next slide. So please go to the next slide. So these are our Adopt a Village Committee members. That's me, Satish Katula, I'm the chair. And members, our Madam President, Anupama Gotemukula, Jagan Alaneni, Dr. Ram Singh from Las Vegas. Next one, please. So last year in November, we have distributed close to 70,000 masks in rural areas of 3 states, including Rajasthan, Andhra Pradesh, and Telangana. These are some of the pictures from that. We worked in collaboration with Global Pragati, which is organized by, which is founded by Dr. Alok Agarwal, who is our beloved API member, and he has done a lot of good work. And this was in association with his organization. Next slide, please. And these are all cloth masks in the peak of COVID pandemic we distributed. And Dr. Janalagadda was also part of this. That happened in his presidency. Next one, please. And we're also doing a community pure water drinking project. We collaborated with what is called CPW, Community Pure Water Project. And this is where they research and find where they need pure water, where water is not pure. They test the water in villages and they suggest which village needs the pure water drinking plant. It costs about $5,000. We have 7 confirmed donors for $5,000 each in various parts of the country, including Punjab, Andhra Pradesh, Telangana. And our API Charitable Foundation was kind enough to pledge $2,000 for each plant for maintenance. And we are planning to recruit more people to sponsor more water plants. And this happened last year during Dr. Sudhakar Janalagadda's presidency. Next one, please. This year, under Dr. Anupama Gotemukula, we have taken this project in commemoration of 75th India's Independence Day to adopt 75 villages to do free health screening, comprehensive screening for the following diseases, including anemia, diabetes with hemoglobin A1C, hypertension, hypercholesterolemia, chronic kidney disease, malnutrition, and hypoxia. So all these things will be done at the point of care where the team of global teleclinics with which we are collaborating, they will go to the villages and do these tests. Next slide, please. And we are doing it in 75 villages, as I mentioned, and 5 states are included in this one. Those are Andhra Pradesh, Gujarat, Karnataka, Tamil Nadu, Telangana, and we will expand it to more states in future as we find more sponsors and as we figure out the logistics. So we'll be asking for sponsors. We do have some sponsors. We'll project that in a minute. Yeah, these are from Andhra Pradesh, Dr. Dhananjay Lakkareddy, Dr. Ram Mova, Dr. Raghu Mendu, Dr. Krishna Reddy. Gujarat, we have Mr. and Mrs. Haralal, Dr. Malti Mehta, Dr. Prakash Patel. For Gujarat, next one, please. Telangana, Dr. Anupama Gotemukula, Dr. Satish Kathula, Dr. Sunil Kaza, Dr. Sunita Reddy, Dr. Vijay Gunaganti, Dr. Ravinder Reddy, and Mr. Ravi Pulling. And these are the sponsors so far, and we are looking for more sponsors. These are pre-launch sponsors, and we want to see more of them to fill all the 75 spots. And if you want to do that, please contact us, or it doesn't have to be a physician. Anybody can do that to adopt a village. It can be any village in any state in one of these 5 states. So we greatly appreciate that if you could do that. So, and I thank everybody again for being here. I know Friday evenings are so precious after weeks worth of your work, but you are here to be in this noble program. And the next thing in the program is we'll have a message from His Excellency Ambassador to the United States from India, Mr. Taranjit Singh Sandhu. We'll play a video message. Vijaya, could you do that, please?
Namaskar. At the outset, I convey my greetings and best wishes to you, on the occasion of India's 75th Independence Day celebrations. Every Independence Day is special, but this year it is truly remarkable. India is entering into 75th year of our independence. Today, we remember with pride and gratitude the efforts of all our visionary leaders, brave men and women who fought for India's freedom. This momentous occasion also presents us with a unique opportunity to reflect upon our journey as a democratic, pluralistic nation. Today we celebrate and value our ideals, strides and successes. We also rededicate and resolve ourselves to building an India where dreams and aspirations of each of 1.3 billion people is realized. It is with these objectives that Prime Minister Narendra Modi launched Azadi Ka Amrit Mahotsav earlier this year. Over the course of 2.5 years, extending up to August 2023, several events would be organized in India and abroad. People's participation would be a key element of these celebrations. I am confident that here in the United States, the diaspora will enthusiastically come forward in celebrating Amrit Mahotsav while adhering to health-related protocols. Friends, our comprehensive global strategic partnership with the United States remains of key significance in bringing development and prosperity to our people. Our ties with the United States are on a steady upward trajectory. Prime Minister Modi's telephone calls with President Biden and Vice President Harris, Prime Minister's participation in the Quad, Climate and G7 summits, the recent visits to India by Secretary of State Blinken, Secretary of Defense General Austin, and Special Envoy Secretary Kerry, visit by External Affairs Minister Dr. Jaishankar to the United States, and a number of other interactions at cabinet and high official levels, all reflect the close ties that we share. I'm sure that we will continue to build on this momentum in the coming days in key areas such as healthcare, digital IT, education and knowledge partnership, clean energy and climate change, and strategic and defense sectors. COVID continues to pose challenges to us. We need to be vigilant, and I hope you and your family and friends remain healthy and safe. The pandemic has taught us that humanity can only survive if we support each other. India has extended its helping hand to the United States last year. This year, during the surge in India, the US government, Congress, private sector, and diaspora provided overwhelming support to India. I take this opportunity to thank each one of you for your generous efforts. I'm confident that with our collective action, we will come out of this stronger and more resilient. Once again, I extend my best wishes to you on the occasion of the 75th Independence Day of India. I also take this opportunity to congratulate each one of you and the community for organizing this special event. Thank you. Jai Hind. Namaskar.
Well, at this time, I would like to invite our beloved past president, Dr. J.S. Shah from San Antonio, Texas, to introduce Honorable Aseem Mahajan, Consul General of Houston. Dr. J.S. Shah.
Oh, thank you, Satish, for the opportunity. It's with a great honor I would like to introduce Aseem R. Mahajan, Honorable Consulate General in Houston. He joined the Indian Foreign Service in 1998, and prior to assuming the charge as a Consulate General here in Houston in January 2020, he was an ambassador to World Trade Organization of Geneva. Consulate General Mahajan is a great friend for us, and he's really helping us for Convention 2022 in San Antonio. So it's with that great honor and privilege, I want to thank Consulate General Mahajan to be here today and tell us, give us some views on Adopt the Village program. Thank you.
Thank you. Thank you, Dr. Jayesh Shah, Dr. Anupama Gotimukula, President API, Dr. Satish Kathula, Chair of Adopt a Village program, all members of the American Association of Physicians of Indian Origin, my colleagues who are there today joining us, and friends. It is truly a privilege and honor always to join meetings like this, especially organized by the doctors in this time of the pandemic, when you are first responders, the true heroes, and you have been strong partners with us. And also on this occasion, when you are launching this program, Adopt a Village, in the Rural Health Initiative in India as part of the Azadi Ka Amrit Mahotsav celebrations. So in the interest of time, my other colleagues I see are going to speak on rural health in India. So I will briefly structure my remarks to cover a few themes. The first, of course, is the India-US partnership in healthcare and medical research. The second, some brief mention of the Government of India initiatives in the area of healthcare, which are ongoing. And then lastly, and more important, I think this is a continuing dialogue. And so many of you are on the call, all doctors who are renowned physicians here who bring so much of pride to all of us, and you are doing great work to deepen this partnership on some ideas and themes which I think we should continue to discuss, of ways to deepen the relations between India and United States in this area, and as well as for the initiatives which you have taken in India and which you have been doing for many years, and you are continuing to evolve and bring new ideas in them. So, as our ambassador mentioned, India and United States as two vibrant democracies having open and multicultural societies, commonalities in culture and shared values are natural partners. Our comprehensive global strategic partnership is broad-based with growing engagement in areas like energy, healthcare, defense, security, trade and investment, and people-to-people contacts. I want to briefly touch upon some of the themes in the area of healthcare and medical research, which is an important component of our India-US partnership. As all of you are aware, during this pandemic also, both countries have continued to cooperate closely with each other in the area of healthcare, especially for strengthening our partnership in the global supply chains for many other initiatives. The Indian Council for Cultural of Medical Research is working closely with the Center for Disease Control and Prevention and the National Institute of Health in the United States. We have many vaccine candidates which are being jointly developed. You are all physicians, you are aware of these candidates in various stages of clinical trials, and India is the largest vaccine manufacturer in the world. There are many partnerships between both countries in that area. India is also amongst the largest producer of generic drugs, which come to United States. As you know, the generic drug market here, India is a large supplier with the largest number of US FDA compliant facilities. In the medical devices sector, the consulate, we had organized an event in April to highlight the opportunities. United States happens to be the largest medical devices market in the world, and India is amongst the fastest growing markets. We are allowing 100% FDI in that area, foreign direct investment, and medical devices again offers a huge potential for partnership. Devices and products like dental equipment and supplies, patient aids, implants, diagnostic imaging, large number of items of surgical supplies, and even the billions of syringes which are going in for administering the vaccines during this pandemic. The second theme, which of course, as I mentioned, I will just briefly touch upon. India has made significant advances in health of its population over the last decade. We are reducing the gap between rural and urban areas, and between rich and poor, and to promote universal access to health coverage. The National Rural Health Mission in India, which I'm sure all of you are aware, was launched to provide accessible and affordable and quality healthcare to the rural population and to especially the vulnerable groups. Ayushmann Bharat is a flagship scheme of the Government of India, which was launched based on the National Health Policy of 2017 to achieve this vision of universal health coverage. It aims to move from sectoral and segmented approach to a holistic delivery system of comprehensive need-based healthcare service. It has two components. Just to briefly mention them, and I'm sure my colleagues who will be joining later will go into an in-depth overview of the rural healthcare system in India, but the health and wellness centers are envisaged to deliver an expanded range of services to address the primary healthcare needs of the entire population in the rural areas, expanding access, universality and equity close to the community. The Pradhan Mantri Jan Arogya Yojana, which is the second component and was launched in September 2018, is a major initiative of Government of India, and I truly think that it is globally one of the truly unique schemes which has been launched in the area of healthcare, given the size, scale and diversity of India. You are all well aware of our large population and the diversity of India. This is the largest health assurance scheme in the world, which aims to provide a health cover of rupees 5 lakhs per family per year for the secondary and tertiary care organizations to poor and vulnerable families, and includes a wide gamut of services, in fact, including almost everything to cover costs related to medical treatment, to drugs, to supplies, to diagnostic services, to physicians' fees, and all other related costs. The primary objective with which this also was set up was to ensure comprehensive coverage for major illnesses of people, reduce the burden of debt on them, and to meet out-of-pocket expenditure, improve access to hospitalization, and to converge the various health schemes of insurance across the states. It will also set up national standards for a large country like India on health assurance system, and I think it has been very successful. The numbers are, you can see on the website, they are growing and the coverage has increased, and a lot of people have benefited from it, and perhaps it is truly unique that way as a scheme which provides access to universal health coverage. Finally, on the topic which I thought we should deliberate a bit more, I will just touch upon some themes. We are celebrating Azadi Ka Amrit Mahotsav. We just celebrated the 75th anniversary of our independence. The Azadi Ka Amrit Mahotsav is going to continue till August 2023. Various initiatives have been planned, as Ambassador highlighted. We are planning initiatives in the area of trade and investment. We are planning initiatives in the area of the national education policy, which offers immense opportunities, cultural initiatives, various other initiatives for promoting people-to-people contact, and celebrations like what you are doing of initiatives to partner for India's development. The major pillars, of course, of these celebrations are covering what we have achieved, our freedom struggle, achievements of India. But I think one of the most important components, which is of high relevance to organizations like API and in the initiative which we are taking together, is of ideas and actions for India at 75. And that is what brings us together. This, the Adopt a Village program, for example, which you have launched, and also our resolve to continue to work for the development of India together and partner. As I mentioned earlier, strengthening healthcare in rural India is a priority for the Government of India, but API can play a big role in that area. I have traveled across the states in southern United States, and let me share that I have met many doctors. In fact, I was in Nebraska yesterday, and I interacted with a group of doctors there. Many doctors are also undertaking initiatives where they go every year to India. They set up camps in different states in India. They partner with Indian doctors. They take groups of doctors from here. So people are doing these undertaking these initiatives in different configurations, and we deeply appreciate that. Some of the ideas which I want to leave for all of you, of course, as I said, it is a continuing dialogue. You're just launching this scheme today, and I find you have also adopted an integrated approach. You are working on an initiative to provide pure drinking water, which I think is equally essential for health. And that is what the holistic approach which Government of India has also undertaken in this Ayushmann Bharat scheme and the various schemes. We can perhaps work together to establish partnerships and memorandums of understandings for collaboration in rural health development. You can have an advisory group. You can work with various agencies in India. You can work with states in India, and of course at the federal level to get the sharing of knowledge and best practices. That will be a big contribution. This initiative can help us to develop a model. I'm sure this Adopt a Village scheme which you have taken for 75 villages across India, you will vary it according to the local needs and perhaps develop a model which can be scaled up, because in a country like India, I think the most important thing is to scale up such initiatives. While you are doing these pilot projects, whatever course correction you do, you should develop a model that we can scale up across India. And there are many people who will be ready to do that. You can learn from this experience and share with us. And I assure you that we will work closely with you on that quarter to help to scale it up, to share what you learned. And you are all people here, based here, who have such wide experience. We truly value that. The other area, of course, I wanted to suggest is training of trainers in India. The recent pandemic has highlighted the need for people being trained on use of things like ventilators, on equipment, and many of these trainings were done virtually recently. I myself saw that there were a lot of people who sent equipment from here, and then they were able to virtually organize training programs. Similarly, you can train trainers in India who can again amplify this whole effort, because ultimately the idea of this whole initiative is to share with the maximum number of people what we can do together. Another area, again, there is, for paucity of time, I will just briefly mention it, is medical education. The new education policy of India, which has been after 36 years, we have a new policy which actually offers immense opportunities for research institutions to partner, for joint exchange programs, for strengthening institutional linkages and other areas. Medical research is a growing and a big area between India and United States. The consulate, we have organized many interactions in the last 1 year in different configurations. This part of United States, in Texas, for example, in Houston, we have the Texas Medical Center, which is one of the largest medical centers in the world. There are many successful collaborations, MD Anderson Cancer Institute, the Baylor College of Medicine, and many others with institutes in India. And there is immense opportunity to partner in the area of hospital administration and management. Your experience, I know doctors who have gone from here, set up their clinics in India, and they've even taken things like urgent care to India. And these are things which obviously, if you share globally, it helps us in adopting some of the best practices. Joint research, innovation, knowledge, even sharing of samples for research. We did a event on the COVID, on the BCG vaccine, and sharing of data in cancer research, sharing of so many new samples and developing new drugs. And why I am mentioning all this is because in every initiative of this kind, I have seen a connect going to the doctors of Indian origin who are here. They really make us proud. As I mentioned in the beginning, they have brought a lot of excellence here and back home also. And all these initiatives are essentially spearheaded by people like you. And we look forward to continuing to work with you in these areas. I also want to mention that we want to work with you to promote our trade and investment in the area of pharmaceuticals and other areas of innovation like digital health. And of course, medical devices I mentioned. Many of your doctors are strongly connected with the medical devices industry. Do help us to connect Indian companies with US companies for technology tie-ups, joint ventures. And India is really emerging as a big market in this area. We had organized a focused event on that. And lastly, as we celebrate Azadi Ka Amrit Mahotsav, and as Dr. Anupama Gotimukla and Dr. Jayesh Shah, both of them are based in San Antonio, we look forward to working closely with you for the API convention from June 23rd to June 26th next year. API at 40 and India at 75. I think these are two themes which we are going to celebrate. I'm sure there will be components in this convention deepening our discussion on the India-US partnership in healthcare and medical research, and also on the research and healthcare initiatives in India, both in rural and urban areas, on how we can scale up our healthcare systems and what you can do together. And I am truly honored to join all of you. As I say, every time meeting the doctors, it gives us a lot of energy and confidence as you are fighting this pandemic for our communities. And wherever I have traveled, also the acknowledgement which people have for the work of Indian physicians and also Indian nurses. In fact, Indian nurses are doing outstanding work also. They are the first responders and they make us proud. So thank you again for giving me this opportunity, and let us continue with this dialogue on what more we can do together. And I congratulate you on this initiative of adopting a village initiative which you are launching. I'm sure this will attract a lot of interest both in India and United States, and I wish you all success. Thank you.
Thank you so much, Mahajanji.
Thank you, Honorable Consul General of Houston, Mr. Asim Mahajanji. So the next speaker we have is Consul General of Chicago, Honorable Amit Kumarji. And I'll call upon Dr. Suresh Reddy, the past president of API, to invite and introduce Honorable Amit Kumarji.
Thank you, Satish, for the kind introduction. Amit Kumarji is a career diplomat and joined the Indian Foreign Service in 1995. He had wide range of experience, having served in headquarters and in several Indian missions abroad. Prior taking to the assignment in Chicago as a CG, he was Deputy Chief of Missions in Ambassador's Office in Washington, D.C., where he was invited as a chief guest at the legislative meet during my time. Amit Kumarji is a very strong supporter of API. Along with his wife, Surabhi ji, Amit Kumarji has not only won the hearts of all the Indians in the Midwest, but he's a household name. And he'll be speaking on rural health in India, current status. And I take this opportunity to announce that I'll be adopting my village of Narsampet, Dwarakpet, Warangal district, Telangana. And let's invite Amit Kumarji with a round of applause. Amit Kumarji.
Thank you very much, Dr. Reddy, for those kind words. Dr. Anupama Gotimukula, the president of API, Dr. Ravi Kohli, president-elect of API, the leadership and the members of API, I'm truly delighted to be present here today at this event to launch API's initiative on Adopt a Village in the backdrop of Amrit Mahotsav. Ambassador of India has already outlined the vision that we have for advancing and deepening India-US relations. My colleague from Houston, Asim Mahajan, has also spoken at length about the opportunities that we have in the healthcare space, and actually moving beyond some healthcare, also looking at hospital administration, looking at vaccine development, looking at export of generic medicines to this country, medical devices, and so on. So there is an entire gamut of healthcare cooperation that both countries are undertaking. I will only, I think later in my remarks, I'll just touch upon the technology aspect of what we are trying to do in India, so that there's less repetition. But I think it's fair to say that in the past 17 and 18 months, where we have dealt with COVID-19 and I still in some ways feel the impact of it, it's important to recognize the role of doctors and the role that API had played. So I'm just wanted to place that on record, our acknowledgement, and I think really speaking on behalf of the embassy and all consulates here in saying that your activities and providing medical assistance to stranded passengers and prescribing medicines for them at the onset of COVID, your activities in trying to spread awareness about COVID-19 and distributing personal protection equipment, both during the first wave locally and raising resources for a second wave. I think we are extremely thankful to what you all have done. I will also take a moment to recognize the great personal risk that doctors have taken in the US, in India, and globally to be at the forefront of our collective efforts against COVID-19. Sadly, the disease also took lives of some of our doctors, so we mourn their loss and convey our condolences. As you might be aware, today we recorded 10 million vaccinations in a single day. This has come on the back of 8 million doses in the previous 2 days. Cumulatively, we have now vaccinated 621 million people in India. As we all know, vaccination is the only way forward, and hopefully we will reach our target of vaccinating all 12 plus people in India over the next 3-4 months. My colleague Asim from Houston had talked about the Ayushmann Bharat scheme. So I'll just sort of go over some elements of it, but I think what is it that we are trying to do here? So for the first time, the government is trying to cover 500 million Indians from low-income groups. We are attempting an innovative public-private partnership, and more than 14,000 hospitals, both public and private, have been empaneled under this scheme. Before COVID struck, we have had an enrollment of around 100 million people who have been issued e-cards for the purpose. The objective was to ensure a cashless transaction system for patients funded by the government at agreed rates with the hospitals. And I think this is, of course, a transformative change where we're trying to leverage technology. And this scheme, when you couple it with last mile strengthening of health infrastructure and potential of telemedical consultations, which ironically was fast-tracked because of COVID, I think taken together will significantly improve healthcare in India. At the same time, if there is an assurance scheme to cover 500 million Indians, it opens up demand for various sectors of the medical ecosystem. And that is why in the beginning I was saying that India and US can do much in areas such as pharmaceuticals, basic research, vaccines, diagnostics, medical devices, hospital administration, and so on. We have seen how digital connectivity has been effectively used for medical consultations and diagnostics. And I think this is an area of particular importance to India, given our large population and the challenges that rural healthcare faces in India. You all are doctors, you follow India very closely, you are aware of the challenges. But to put it in a nutshell, around 80% of our healthcare infrastructure in India is really geared towards the urban sector, where our bulk of population is in rural areas. So that is why your initiative is so important for us in bolstering rural infrastructure. But I also just wanted to acknowledge your other initiatives, which I think precisely try to address this gap. For example, your MOU with the Apollo Hospitals Group to deliver virtual second opinion and consultations to Indians in rural areas was such a welcome initiative. Now, similarly, your initiative in partnering with Tata Trust in developing a distributive model for cancer care through digitally connected centers across India was yet I think another innovative model where you're trying to leverage technology to deliver quality cancer care. In a similar vein, you work on clean water programs for communities in India, or work with USAID towards the goal of eradicating tuberculosis in India, are also, I think, very, are very noteworthy. Now, I'll just end my remarks by saying that you all are experts on area, and I think there is a lot of new startups which are coming up in the healthcare space in India. I would urge you all to take a closer look at these startups, and you may be able to actually offer technical advice on what they can do. And I think your vast experience will help here. I'll just give example of the 3 startups in India. So there was this startup called Blackfrog Technologies that came up in Manipur, in Imphal, and the problem that they were trying to address was, how do you take vaccines to remote mountainous areas there in the northeast? And they developed a solar-powered vaccine carrier to maintain temperatures, and this was developed especially for COVID vaccination, but of course it has wider uses. And then there are 2 other startups which came up. There is a Grameen Healthcare, which covers several states in North India. For the moment, it covers around 1,000 villages. But the idea is to supplement teleconsultations, telemedical consultations, and do door-to-door delivery of medicines in rural areas. A few startups have come up to plug the gaps in supply chain disruptions which happened. So those more are on lines of e-commerce and how e-commerce platforms that were meant specifically for medical supplies. Now, what Grameen Healthcare has done was to ensure delivery of quality medicines at affordable prices to rural areas. There's another startup called Medishala, which is Patna-based startup, that has actually looked at the problem of patients going to doctors, and they've turned it around, and they've worked with a network of volunteer doctors who visit villages, and so in a sense this startup brings doctors to the villages, and again it addresses a crucial gap therein. So I think there is a lot of potential in trying to use technology to address some of the challenges that we face. And we all know when it comes to computers, for example, how we basically sort of skipped the PC phase. Some moved to laptop, but much of data in India today is consumed through smartphones. Similarly, I think we'll have to look at the problems of healthcare, rural healthcare infrastructure a little differently, and try and see how we can leverage technology. With those words, I'll just conclude my remarks. I would just like to acknowledge the important work that API is doing, commend its leadership for their initiatives vis-a-vis India in bringing together their vast experience to advocate for better programs and for medical education, for building capacities in India, and now a more concerted and focused effort on sort of ramping up rural infrastructure in India. Thank you very much.
Thank you, Honorable Amit Kumarji, for that excellent message. Next, we'll move on to invite Dr. Sudhakar Janalgadda, immediate past president of API and PBS awardee, to introduce Honorable Dr. Swati Kulkarni, Consul General of Atlanta. Dr. Sudhakar.
Thank you, Dr. Katla. It is my honor and privilege to introduce the Honorable Consul General Dr. Swati Kulkarni. She is a career diplomat, graduate from Nagapur Medical College. Before she took charge of the Consul General of Atlanta, she was the Consul General at Cape Town, South Africa. Before, she worked as the first Secretary of High Commission of India in England. and she was a nodal officer. She really worked hard at preventing discrimination for Indian medical graduates after UK implementing some new immigration laws. Doctor understand, doctor spot. Thank you for that. And Atlanta is very fortunate to have a dynamic diplomat, Dr. Swati Kulkarni. And please welcome Dr. Swati Kulkarni, and she's going to talk about how API and NRI doctors can help India. Welcome.
Thank you, Dr. Sudhakar. It's always nice to interact with API. My warm greetings to all of you. See, it is good to know that API has initiated a program called Adopt a Village. So this program in 75 villages in 5 states is really a commendable initiative. It's very wonderful, it's laudable. And it's laudable why? Because we are doing it against the backdrop of celebration of 75th year of independence, what we call a democratic festival, the Freedom Festival Azadi Ka Amrut Mahotsav. So that's why it's really important that you have taken this, undertaken this program. I have been associated with API, GAPI and other doctor associations very, very closely. Latest, I have attended your API function, your GAPI function, and just few days back, I also attended AKMG, those Kerala Medical Graduate Function. I can tell you that the program was meticulously planned all the time. So it's so nice to see that how you are showcasing your unity, how you are showcasing your skill set, how you are showcasing your diligence and your entrepreneurial spirit. So that's where we are proud of you. And that's how, your infectious enthusiasm makes us that how you are dedicated in what you want to do that. So let me focus on how API can further help, the NRI doctors can further help India. So I'll focus on 4 segments in this regard. The first and foremost is diplomacy for development. So we as a diplomat always focus on development which happens in India. So why the development? Because development first, as our leadership has made it clear that it has to be a very, fast track. It has to be inclusive. It has to be sustainable. Second thing, the government is very clear that we need expertise. We need overseas expertise. We need our expertise of our Indian people who are all over the world. So that expertise we want, and you are in the best position because you know India, you know this part of the world very well, like a back of your hand. And the third thing, we cannot, always see development as a GDP growth. In country like India, it has to be all-round development where we want to have the very clear objectives. And our leadership has come forward and they have given very clear objectives. They have made it into various projects, the sustainable projects like Clean India, Make in India, those Digital India. So API can campaign for them. API can get involved with them. I'm sure many NRI doctors are already there. So there also API can become a very important stakeholder. The second and important thing is, Indian healthcare industry. You are seeing that due to COVID, the healthcare has become very important aspect for everybody on this planet. In USA, the healthcare market is 3.7 trillion. It will grow to 4.5 trillion by 2023. Likewise, in India, the healthcare market is 100 billion plus industry. It will become 350 billion plus industry by 2023. You know that how the hospital sector is booming in India. It's $60 billion plus industry. It's giving a lot of employment, a lot of revenue is being earned by doctors. And the second most important industry in the healthcare is pharmaceutical. We are already pharmacy of the world. So you know that we are giving 50% of vaccines to the world. We are giving 20% of generic medicine. So, and to the USA, we are giving 40% of generic demand of USA. Then upcoming segments are, we have medical devices, medical tourism, healthcare, the Ayurveda and other things. So there again, API is an important stakeholder for us because I have seen so many NRI doctors investing in this upcoming medical revolution. So you are already there. We just need to strengthen it. We just need to augment it because we have seen IT revolution and now we want to see the medical revolution. Then third segment which we can touch upon is the India-US healthcare. So you have seen that underpinning this Indo-US healthcare is a vast knowledge and research partnership. And it is driven by people who got educated here, and almost 200,000 students are here who are in STEM areas. And you guys also, many of you came from India and you are here. Many people have gone back to India. Bharat Biotech couple is example. They have done so much good work during COVID. So we have this vast ecosystem of people who are there. They have their skill set, again, their spirit of working hard. So that can also help, and API is right there in that way to become an important stakeholder in India-US health collaboration. And the fourth most important segment is India-US political discourse. See, you have to become active participant in this discourse. You have to give the balanced narrative on India. You have to meet with people at local level, state level, federal level, and tell them about India at a sustained basis. So you are already doing that. We are very happy. We need to augment it further. So again, you are an important stakeholder in that. So API for us, for Indian government, is an extraordinary resource. And we look at you as a vital bond between the two countries. So let us invest in making better future, better tomorrow, and let us invest in making focused and sustained efforts. Jai Hind. Thank you.
Thank you, Honorable Swati Kulkarni ji. That was a great message, very inspirational. Thank you so much for being here with us today. And the next program we have is Dr. Kohli, the president-elect of API, will introduce the founder of Global Teleclinics, Dr. Murthy Gokula from Ohio, who is a geriatrician, a professor of medicine. Dr. Ravi Kohli.
Good evening. Thank you for inviting me to introduce Dr. Gokula Murthy, my good friend. I want to thank all the Consul Generals for taking the time to be with us. And I also want to applaud all the members for being here and generously supporting the initiative. I just want to mention a few things. It's a tale of two cities. We're in the best of the time and the worst of the times. We're in the age of wisdom as well as the age of foolishness. And India has done a spectacular job of lifting many people's lives from poverty into middle class and healthy health and education. So, but we have a long way ahead. And we still have a lot of goals to reach. And but we have to look at the positives. We have the life expectancy of 71 years now, as opposed to 58 years in 1990 and 41 years in 1960. That's a laudable and a spectacular development. We need to be very appreciative of that spectacular progress. But there are challenges that we have to accept. We have the highest TB burden. 700,000 patients are every year untreated, and we still have the underweight, malnourished infants under age 5, the highest rate in the world, and that's also in tangent with maternal childbearing age anemia. So we are screening for all these issues. So this is the crux of the problem, and that's what we're addressing here. And the rural health disparity is also it's similar theme here in America. There's a high mortality and morbidity in rural population, and the family practice medicine physicians are the linchpins of rural healthcare, both in America as well as they're going to be the same foundational pioneers in India if we allow the postgraduate education in India to be also be allowed in family medicine field. So we need to initiate that movement. Dr. Lokesh Idra has taken the challenge. We want all the CGs to, during their communiques with the Minister of Health, Minister of External Affairs, to stress the importance of the family medicine postgraduate training that will lift the health of the rural population as well as urban dwellers. And who is better than a family practitioner, Dr. Gokula Murthy, to talk about the initiatives that he has started. So I invite my good friend, Dr. Gokula Murthy, to present his ideas and his plans on how he's going to assist API on Adoptive Village program. Thank you, Dr. Gokula Murthy.
Thank you, Ravi. Can you please show my slides? I want to thank each and everyone, especially the Consul Generals, for being so kind to come onto this meeting. this evening on a Friday, and thank the API leadership, Anupama, Satish, and Ravi, my very good friends. And caring has the gift of making the ordinary special. And who else can do that better than API, who have been successful, all the people on this call and in the membership all along have done great things and made our community pride here in the United States the strongest and the boldest. And then now creating and bridging the divide between the rural and urban India. And my goal of doing rural health programs all the time for the last 6 years has been to disrupt primary care through blending medicine and technology. And we actually founded this 6 years ago, and we screened with CSR funding from Hero Honda, Aditya Birla Group, and Idea Cellular, about 2.5 lakh people through a innovative device developed in India called Health Cubed. And then now we moved on to create our own digital platform. And the Consul General has mentioned the digital health is the way that you can scale. And with the COVID programs that we have done using technology, we feel very emboldened. And I feel personally emboldened because I've been practicing telemedicine in the United States from 2013, that this is a great opportunity, that you all know that a country will not be a good place for any of us to live in unless we make it a good place for all us to live in. Theodore Roosevelt said that. And with that energy, I want to thank the leadership and want to go to the next slide to explain the details of the program and how it's done and what we think. You all know that what I need to do is primary care to the last mile, sustainable, lean healthcare infrastructure. We need awareness, education, and infrastructure, which is in physical and digital. What we'll do is we'll pick 15 villages in each of these states, and the sponsors have the right to choose whichever village they want. And then if it is from their own village, we would like to get their relative or friend as the champion. And then we want to kind of embolden the pre-visit by trying to get the approvals from the local health authorities. And why do we want to do this? We want to make sure that we do this right. And we want to measure the key vitals to determine the health of a village, identify diseases and the root cause, and determine action plan for the future. So I'm a family physician, a geriatric specialist, hospice palliative medicine, and recently I got certified in lifestyle medicine. Now my passion for medicine actually has rejuvenated with trying to do disease reversal. And that's what I'm trying to do through global teleclinics, trying to create programs on disease reversal and address the chronic diseases that 80% of United States is plagued with. And every 6th Indian is a diabetic in the global arena. So I want to collect all this data, publish the data for healthcare community, and all this data will be actually digitally recorded on the platform. And then we can actually collaborate with the local leaders and in healthcare and kind of create informed decisions related to infrastructure needs. We already have the system. I'm not trying to recreate. I'm only trying to complement what's already existing within the infrastructure in India and how we use technology and do a public-private partnership and show how not-for-profit can make a huge difference, and each of us can actually make the difference. Next slide, please. So what we're going to screen is the height, weight, and the BMI, and then hip-waist ratio. With this simple thing, you can actually assess malnutrition and obesity. And then the leadership has come across saying that we want to screen based on the obesity growing endemic problem in India too as well. The BMI, hemoglobin A1C, and we're going to check for the blood pressure, the temperature, the pulse oximetry, to basically understand what's their pulse ox. If they're smoking and their oxygen is low, then serum creatinine for kidney diseases, lipid profile to screen for hyperlipidemia, and CBC to check for anemia. We initially, since I'm from both AP and Telangana because of my mother being from Andhra Pradesh and father being from Telangana, it was the state we focused for the last 6 years, and we already have boots on the ground. And adjoining areas, Karnataka, Tamil Nadu, and Gujarat would be the pilot project. This is the first pilot project, and my goal and vision is that we can make this an yearly program, wherein next year we would say 76 villages on the 76th year of independence, 77 villages the following year for the 77th year of independence. And I hope API leadership can make a note of this and continue this, because this is what will actually make my life what's it worth, that I thought that I'm born to serve humanity and make a difference. And I'm sure all the people on this call also have the same idea and vision. Next slide, please. So it's the choice for the people in these states, or you don't have to be from this state. Anybody can sponsor any of the village in these 5 states, because this is what we have planned for. And if you have your own member or of the family friend, he will become the sponsor. So then our staff will communicate with the champion, we call them the village champion or the village contact, and we will tell him how we'll do the program. We'll identify the place where we can do this program. We get all the approval from the district health medical officer, make sure that we are following all the COVID guidelines, because we're going to do this in the middle of a pandemic. And we will work with the API team, and we will screen for all these health conditions. We're going to take a mobile lab, basically from a diagnostic lab, and screen for all these conditions. And one of our staff will be simultaneously entering this into the digital platform. And we will actually in real time be able to get the data and publish the data. So the donor will actually get what we have actually done through a small clippings of the pictures or the video, and the local press will be there if they're available, and we will show what we have done. And my staff, we will be hiring a physician locally in India who will actually, all the positives, they will do a telemedicine consult, and then we will kind of engage them in a disease reversal process. Obviously, we'll give them the medications, which we're all trained for, but our goal would be to screen and prevent. So this is not a one-time program that we are screening. This is totally unique. With all the CSR funding we did, we just screened one time and we're done. I saw the comments, and this is really good that we will take all the necessary precautions, and we will make sure that the follow-up is done. And obviously we'll give the data to the API, and the API will control how this data is done. Next slide, please. So what we'll do is we will be there. It's not like we are handing off the baton. We want to really be there for API, because I'm the founder of Toledo Physicians of Indian origin, and leaders have helped me from Ohio to do that. So we want to carry on the, it's like a marathon and a relay, wherein we are handing off the baton to the next generation. So I want to kind of close my remarks to say that I slept and dreamt that life was a joy. I awoke and I saw the life was service. I acted, and behold, service was joy, by Rabindranath Tagore, our wonderful leader from India. And I want to thank API leadership for this time, and all of you for attending this event. Thank you. Jai Hind.
Thank you, Dr. Murthy, for the excellent presentation. And now I would like to invite Dr. Mukesh Nigam, Vice Chair of Board of Trustees of API, to invite Honorable Randhir Jaiswalji, the Consul General of New York. Dr. Mukesh.
Thank you, Satish. It's my privilege to introduce Mr. Honorable Randhir Jaiswalji. He's a career diplomat who joined Indian Foreign Services in 1998. And during this career, he served in Portugal, Cuba, South Africa, and he's been in New York since last year. He also helped the President of India with the international relations in his team as a secretary. It's my privilege again to invite him, and we want as API members to know what's the status of rural health, and what's the planning. Again, what are the challenges they are facing, and if you can enlighten us with the solutions they are envisaging to have a solution in India for the rural health. Yes, with those words, I welcome Mr. Randhir Jaiswal. Thank you, Jaiswalji, for attending.
Good evening, everybody, and a very warm namaste to all of you from New York. Dr. Anupama Mukula, President of API, Dr. Satish Kathula, who invited me very graciously to this function, and Dr. Mukesh, thank you for your very generous introduction. I am delighted to be here, to be part of this very beautiful and meaningful program where we are launching together Adopt a Village project. It is part of India at 75 celebrations, and for that reason, it makes the project even more meaningful. As you know, that we have begun our celebrations of Azadi Ka Amrit Mahotsav. We celebrated India's 75th Independence Day in New York and across the United States with a lot of fanfare. And thank you very much for joining these celebrations. As the Prime Minister of India, Narendra Modi, while speaking from the ramparts of Red Fort, said that while 15th August, 75th Independence Day of India may be a day to remember all our achievements and bask in glory in our vibrant democracy, it is also an occasion for us to introspect and to make a resolve to chart our future, to build a new India. I am delighted that the project, very meaningful and deep project you have undertaken today to provide helping hand to people in India, people in rural India, where health infrastructure needs support from government, from other stakeholders of society. So this, of course, it makes your project that much more meaningful. And it fits very well into this thought that the Prime Minister outlined. While in India, we are focused on building next generation infrastructure, transformational growth, but at the same time, we remain equally committed to meeting basic needs of our population. You would have seen the kind of focus that is there in India today on providing clean drinking water, be it the Jal Jeevan mission, under which we provided 40 million households with tap connections. And the target is to provide all rural households with a tap connection for clean drinking water by 2024. Or the Ayushmann Bharat, which is the largest of its kind health insurance scheme, anchored by the government, or the women empowerment programs such as Beti Bachao, Beti Padhao, or the financial services program. All these programs put together are all designed to meet basic needs of a population and at the same time help us in meeting our sustainable development goals commitment, which will be measured, which has to be achieved by 2030. Well, my friends have already spoken, my colleagues have spoken eloquently about various aspects of the health challenges in India. One aspect I would like to highlight, because it's a matter of great pride for all of us, and me in particular, that we have developed the first DNA vaccine, ZyCoV-D, and we have given emergency approval. It will add to our ongoing vaccination drive. So that is something that is very special to us and has made global headlines. I would say that I wish API the very best. You've done exceedingly well when you came forward with help and support during the second surge of COVID-19. We deeply appreciate, and all the people back home who've received support from you are equally grateful to you. And I wish you the very best for this project. And it has begun with a bang here, and I hope over the next year or so, etc., we'll see this project running in mission mode, and I look forward to its success. Thank you very much for your very kind and gracious invitation, and look forward to strengthening our partnership between India and API, partnership between India and the government of India, partnership between India and civil societies in India. Thank you very much.
Thank you, Honorable Jaiswalji. That was an incredible message And we really value that. And I really appreciate for accepting the invitation and being with us tonight. And the next speaker we have is Deputy Consul General of San Francisco, Honorable Rajesh Nayak. And I would like to invite my good friend, Dr. Sujit Punnam, a renowned cardiologist from California, Regional Director of Pacific Region of API, to introduce Honorable Rajesh Nayak.
Thank you, Satish. Thank you for calling me a renowned cardiologist. So I take the honor of introducing the Deputy Consul General of San Francisco, Honorable Rajesh Nayak ji. He is filling in for the Consul General who is on an official trip to San Diego. Rajesh ji has earlier served in Indian mission in Tokyo and in New Delhi before his current assignment. And for our audience today, he's going to talk on rural health, what India can learn from developed countries. Rajesh ji.
Thank you, Dr. Sujit, Dr. Anupama ji, Dr. Ravi ji, Dr. Satish ji, and all the office bearers of API, and my senior consul generals from different consulates in the United States. Thank you very much for this opportunity to address this event of API. I'm honored to be here representing Consulate General of India in San Francisco. I'm filling in for my Consul General who wanted to be here very much in this event, but unfortunately had to be away in San Diego, another clashing engagement. Let me assure you right in the beginning that I'm not going to loading you all with another boring speech. I will be very brief, but I would like to mention very few points. First of all, API's network, the doctors from API had been a tremendous source of support when we as Indians here in the United States went through the COVID surge, especially in the early days of COVID in March 2020 and the months following after that, when Indian community, thousands of Indian community members were stuck here. We were just arranging evacuation flights for that. There was this gap of few weeks, and then people were concerned about their medical supplies and all that. With the help of the embassy and the consulates, the help of the API, we were able to set up a network of doctors who were able to assist these Indian citizens stuck over here. They did not have access to insurance. They needed medical supplies. They needed doctors' references to buy medicines over here. But this network of doctors came forward, helped our community member. It was a huge crisis, but then the way doctors managed it, the way API managed it, it came as a big relief to us also, consulate as well. And this network was so popular. Let me tell you, we had messages, we had emails, we had phone calls from American citizens saying that, okay, you have a very popular, very effective doctors network. Why don't you give access to them? We would like to go to them. I don't want to go to my insurance company. This actually happened. That actually talks about how much API is sharing its concern for fellow Indians over here. And the second incident I would like to highlight is the recent COVID surge in India, the second wave that struck us. And again, we requested our doctors, our friends in the doctors community in API as well, to help us with medical supplies, to assist our hospitals, to assist our medical infrastructure to help thousands of patients in India waiting for medical supplies. API has stepped forward. You alerted your network, you motivated your sources. Millions of dollars worth medical supply was sent from here. I'm very sure that that has helped to save thousands of lives back in India. So for this great service, I would like to reiterate, I would like to underline our sincere gratitude to all the doctors in API for standing by us, standing by the citizens of India, standing by India in helping us at times of need. Friends, I don't want to go over in explaining what all things are required. You are all very, very well qualified people. You know more about health sector, healthcare services than myself. But I just would like to highlight a couple of things. As Dr. Murthy mentioned, the one thing what we required in order to immediately address the concerns in rural health. We know there are issues. We know there are issues of infrastructure. We know issues of access, medical facilities, availability of medical equipment, the labs, and of course there is also issues of the ability of people to afford this medical treatment. There are many issues which you are all aware of. These building up these infrastructure, these long-term solutions will take time. But however, to address these concerns as an immediate measure, what we can do, as Dr. Murthy highlighted, I would like to fall back upon that. and bring back that element of telemedicine and the remote assistance. The way API network has helped our people over here, we can set up some mechanism in encouraging technology infusion in addressing the rural health concerns in India. This could be something, as an immediate measure, help the existing crisis in the country. I also would like to say that, a villager in Andhra Pradesh, a villager in remote village in Jharkhand, they will be able to connect with doctors based in Delhi, or maybe doctors in, one of the doctors in API to get that assistance. What is important in India, we float ideas, we float programs, but sometimes we need this practical input. You have that experience, you have the expertise, how these networks work here. Probably you can advise, you can, share your knowledge with our, health establishment, with state government, with district administration in setting up this network. That is one thing I would like to highlight. And the second important thing is that many a times in India, the focus exclusively remains on the curative aspect. We look at, healthcare means for us is about setting up the hospital. This is about treating the patient. But there's a lot more that needs to be done on the preventive side. Dr. Murthy also mentioned, I could see some of the comments that came in the chat box about the preventive side. That is where I think we need to invest more. The preventive aspects requires a lot of, expertise, investment of the expertise. It is not as expensive as the curative side, but then it could be very, very effective in preventing or saving the society from the disease burden. In this aspect also, I would see more active, proactive role from API. Please, help us with your expertise, with your knowledge. And another point I would like to say that whenever we think of helping India, helping rural communities in India, we think of rural communities in Andhra Pradesh, in Karnataka, or in Maharashtra. It's very natural, most of us come from these states, but there is a great need in northeastern India. There is a great need in some of the smaller states like Jharkhand and Chhattisgarh. And probably network of API can help these, and these states are very, very welcoming, very eager to accept the solutions, suggestions, very eager to host this kind of new ways of addressing the concerns or issues at their end. Probably API can think in terms of liaising with state governments, liaising with district councils, northeastern states, some of the regions with, a lack of access to proper healthcare facilities and all that. Probably you can help them in setting up some of the measures to address the healthcare concerns. This is what I wanted to share, and I'm truly privileged to be here. And I would like to, stress once again that if API needs any assistance, my consul generals mentioned it. API need any assistance, any help in reaching out to some of the states in India, some of the districts in India, some of the rural communities in India, consulates all over the United States, always stand prepared to assist you. It's an honor, it's a privilege to join all of you. I wish you all the very best for your great initiative. Thank you so much.
Thank you, Honorable Rajesh Naik ji. That was a dynamic and a great message. And it was our privilege and honor and duty to really serve India, because that's where we went to medical school. And most of us, went for, free med school without paying anything. It's our time to pay back. And definitely it was a privilege, and we were so thrilled to do that. And anytime, anything you need for India, we are there for you. Thank you so much. And I would like to invite Dr. Lokesh Adara to speak for a minute. I think he has a slide to show. And I request Ms. Vijaya Kodali to project that slide.
Thank you so much. This is Lokesh Adara, Chairman for the API Global Medical Education. Thank you so much for all the Consulate Generals. Amazing chance for us to interact with it. We have if I have to summarize one request from us, we've been API working and begging for last 4 years. Begging. It is I'm going to send some slides, and then I'll request my request. So rural village, family medicine postgraduate. People lost faith in MBBS doctors. They want to postgraduate. They rather go to sorry, my wording is really, really harsh, because that's coming from my heart of bleeding for last 3 years. People are now going to RMP rather than MBBS doctor. MBBS, 1.6 lakhs of MBBS doctors don't have postgraduate. Family medicine, UK is advanced. 20% of their doctors are family doctors. Australia, 30% are family doctors. And then here is India needs 15,000 postgraduates every year. Mandatory family medicine department in all 554 medical colleges. For last 3 years, I have written 20 letters from top to bottom. The mandatory department is the one which delivers the, and this is Modi ji in this law. There is NMC bill said mandatory curriculum, mandatory postgraduate seat. It is there, but taking NMC taken up. That's what we need. We really need all of your help. This essentially requirement of, as per NMC Gazette signed by President of India, and need help from government to implement this role. We have to get the mandatory. There's yesterday I just said in Tamil Nadu, one stroke of a pen created 5 PG seats in emergency medicine. 150 seats are coming. So that's an example. Family medicine postgraduate, rural health. India barely 120 seats, only 10 MD seats. Compared to America, for last 40 years, 4,823 per year. And out of 35,000, 15%. UK has 20%, Australia 30. India needs at least 15, 12,000, 15,000. Next slide. How does rural India benefit family medicine? Family medicine physicians help improving rural health via providing comprehensive medical surgical care to the communities in the rural suburban areas. Even suburban outpatient, they help. They're the salvation of fragmented health. They're the solution for fragmented health. All the members of family can get benefit from seeing family doctor. In rural area, it is very difficult to recruit specialty doctors. Even compared to the UK, they have very stronger primary care. For 100 people, only I think 17 go to the emergency visits. Where in America, 15% of family medicine, but they have 46 people go to ER. So UK primary care is more strengthening. Thank you for giving me this opportunity. Thank you, sir.
Thank you, Dr. Edera. That was an excellent message from you, and you are so passionate about international medical education, and you have done a lot, and you have introduced, you were instrumental in introducing emergency medicine in India, and I know how passionate you are with all these things. So hopefully we can have this residency there, and we need help from all the dignitaries and officials here to influence Indian government to make this happen. So we will be talking to you again. But thank you, and thank you all for joining. And we have a program lined up, a musical program by the Blue Soul. It's an orchestra. They're going to sing some songs to entertain us tonight. And we'll be starting that in a minute. They're trying to join through their Zoom link. And as soon as they are here, we'll start the music program. Please be patient for another few minutes before they join. Thank you so much.
Satish?
Yeah.
Thank you, Satish, for emceeing such eloquently and elegantly. While we're waiting, if anybody has any questions, we can allow them to open up to me, maybe.
Anyone has any questions? We are still looking for some sponsors, and we appreciate the people who typed in the chat box, for coming forward and sponsoring some villages. And we are doing it in 5 states, as we mentioned before: Gujarat, Karnataka, Tamil Nadu, Telangana, Andhra Pradesh. So anybody can sponsor in any state. It doesn't have to be your state. If you're from Punjab, if you're from any other state, you can choose. Pick and choose any village in any of these states and sponsor. It's $2,500, and you can screen comprehensively for preventive health for up to 200 people. So, if you can type in the chat box, that'd be great. But if you want to contact us, I'll put my number here. So you can always call me if you have any questions or if you're interested in sponsoring a village. So please look at the chat box for my contact number.
Satish, there are 2 physicians who raised their hands. Probably they have a question, if you can unmute them. Vijaya, okay. Can you unmute Dr. Meera and Dr. Saras? One of them.
And Rajeshri has a question.
while we wait for the musical band to join us, so I think we should open up the, to express each physician if they have anything to say. So, okay, so Dr. Meera, you are unmuted. Go ahead.
Hi. Yeah, hi. It is an excellent presentation, and I thank API for taking this initiative. As a practicing family physician in New York State for past 30 years, Dr. Lokesh Hidara has highlighted the difficulty of convincing the ivory tower medicine, which I went through with the Manhattan medical schools and so on, in convincing to have the family medicine residency programs. So even now we don't have in Manhattan schools family practice department or family medicine except Mount Sinai, but I do sympathize and echo his path to hopefully wish we can overcome this. And another suggestion about the rural health, I'm also a founding president of the Indo-American Development Health Organization since the HIV epidemic for past 12, 15 years. And I have this mobile health and rural health, that's where we've been servicing comprehensive centers, and taking just one village might be a very too small a thing. That's the advice I got when I said, okay, do the screening for my village for HIV. Then the suggestions I got was, instead of taking one village, take a cluster of villages and screen them. And for the resources we spend, that might give us a better outcome. So we have a lot of data. I partner with Lepra Society, which is pioneer in doing their leprosy and filaria, all the infectious disease and poverty related. So I do commend API, and I will involve myself in some way or the other in trying to sponsor some villages. That's not the big issue, but it's the implementation of it and follow up. So what we do is we also connect with PHCs, and we have shown with our data that we have reduced blood pressures, mortality, myocardial infarctions, and maternal mortality, and anemia also has improved. Anemia is a big problem. And thinking that somehow you go from America, somebody is going to listen to you, you have to win the trust of the people. Make no mistake about it. You have to have consistency. You have to be there. If you say you're coming into Wednesday or Thursday afternoons, half a day, it was very difficult. We had ASHA workers are another good resource to take help, because they know the village, they know who is pregnant, they know how to sort of convince them. So you really need the trust, win the trust. So that's all. Thank you.
Thank you, Meera.
People are asking how to, one more time, summarize.
Thank you, Meeraji, for those kind words of advice. And the rural urban disparity of healthcare outcomes are even evident in America. And most of the rural healthcare is provided by family physicians in America. So Dr. Ayudara's initiative of training more family medicine physician is really a crucial linchpin for this kind of rural health initiatives.
Ravi, can I jump in? There are some questions about rural village, or can it be outskirts or city urban?
Yes, sir.
Can be anybody, any place that you think it needs to be done. And somebody was asking about the process. It'll be very simple. You contact the API leadership saying that you're going to donate.
There's a link from API. I'll post it on the chat box.
Yeah. And then we will connect with you, identify the champion in the village. We'll make all the necessary regulatory requirements. And I like Dr. Meera's advice about connecting with the PHC locally, and also the ASHA worker, which actually I did a lot in the past with my CSR funding activities. And then we will have this scheduled date. We'll advertise in the local area. We will screen up to 200 people. We have a digital platform that will enter the data, and whoever screens positive, we'll have a mobile lab with us. And when things are positive, we will have our MBBS physician who will connect with them through telemedicine and follow up on that. Our goal is to continue this process on an ongoing basis rather than doing, I don't like to be shine and mine. I want to, I want to shine and mine, which means like I like to shine at the same time, mine deep and keep going on this project every year. And with Dr. Idara's project about rural India, we actually did mission work in Guatemala, and where there is no doctor, there is a book that talks about how you can educate the local physician, local healthcare providers. And my contact information is area code 517-896-0360. I'll be happy to chat. And if you have any questions, in the interest of time, I'll be happy to talk to them.
Thank you. I see that I'm unmuted. May I go ahead, please?
Yes, Saras, go ahead, please.
Hi, thank you. Thank you so much, Api and Anupama and Satish. I think this is a great, great initiative because Api has a lot of resources and a lot of networking capabilities. I think it'll help India at large. So, as I've posted in the text box, we started this Adopt a Village Global Foundation during the second wave, what happened in India, because just like all of us, we want to do something, right? We just can't sit back and see what's going on in India. And, but as Meera and Dr. Murthy, both of them were mentioning, there are always so many hurdles when you go to the village and start working at the grassroots levels. And I think they said very well regarding coordinating with the RMPs and everybody else. But my question to Api is, like smaller organizations like ours, right? It has limited resources. So I want to know, Api has a very big heart. So we want to know if they would, it's about co-creating. We don't want to do duplicate work or things like that. And we want to know if Api would be welcoming and at least hearing our thoughts from smaller organizations like ours, like mine.
Thanks, Saras. And
for both Anupama and Dr. Satish.
Thanks, Saras. And we have our BOT, Dr. Raghu Lolabatu, want to say a few words. Can you unmute?
Yes, I did. Thanks, Satish. And Anupama is a great program, and it's my the pleasure and really privilege to be part of it. As a board of trustees, we definitely appreciate what you are doing. And I don't want to take too much time. Personally, I will definitely participate in this program very actively. I love what the program is. And the second thing is from the BOT standpoint, of course, our chair is not able to join today. So I would like a privilege to take they represent the BOT. Of course, we have Dr. Lokesh is here, Dr. Ranga is here too. And so we definitely, from Board of Trustees, will definitely take active part in this the program, and we'll make it success. Thank you.
Thanks, Raghu. I would like to thank Dr. Anupama Godamukala for giving me this opportunity. And I would like to thank His Excellency Taranjit Singh Sandhuji, Ambassador to the US from India. I would like to thank Honorable Asim Mahajan, Consul General of Houston, and Honorable Consul General of Chicago, Honorable Amit Kumarji. And thanks to Honorable Dr. Swati Kulkarni, CG of Atlanta. And thanks to Mr. Randhir Jaiswal, Consul General of New York, for spending their valuable time with us tonight on a Friday evening. And Deputy Consul General of San Francisco, Honorable Rajesh Naik, thank you so much for your valuable message. And all our moderators, Dr. Jay Shah, Dr. Suresh Reddy, Dr. Sudhakar Janalagadda, Dr. Ravi Kohli, Dr. Mukesh Nigam, for introducing all our guests of honors tonight.